Hi, in this video, I'm going to be talking about peripheral neuropathy in people with cancer. Peripheral neuropathy, two words. Peripheral means these are the nerves that are not in the central nervous system, so the brain, for example, and the spinal cord. Peripheral nerves are the ones in particular that innervate or feed our hands and feet, our gut, and our skin. And you will hear sometimes people talking about getting pain in their fingertips or their toes when they're getting chemotherapy, because indeed, chemotherapy is the biggest risk factor for peripheral neuropathy. We don't see it in people getting radiation therapy, and we don't see it in people getting surgery alone unless there was nerve compression during the surgical procedure. If you've ever been in an operating room and been an observer, you notice that the surgeons and anesthesiologists and nurses are very careful to make sure that none of the nerves in your body will be compressed, and that's generally reversible. With chemotherapy-induced peripheral neuropathy, it's also generally reversible, not always. And if those of you are watching and you have long-lasting, long-term peripheral neuropathy, I wish this hadn't happened to you. It's a side effect that we can usually see get better after the chemotherapy is stopped, but not for everyone. And I'll be talking about treatment options in just a moment. So, what causes peripheral neuropathy? Well, as I mentioned, chemotherapy does. There are other things that do as well. People with diabetes can have neuropathy, and I'm doing this with my fingers because they tend to describe numbness in the fingertips and again the toes. The odd thing about this is that it can be a painful numbness, which sounds really strange, because if you have numbness, why would it be painful? But that's the way it is. We're just very complicated beings. Chemotherapies, not all of them cause peripheral neuropathy. The ones that are most likely to do this are paclitaxel, docetaxel, carboplatin, and exabepione. Eribulin is another one that can do it. So these drugs are toxins to the nerves. In people with other toxins, they can also get neuropathy. So these are drugs that shouldn't be in your body, and your body's doing a really good job getting rid of them, but they can affect the nerves, and in particular, the nerves of the fingers and toes. We call this a stocking and glove distribution. If you have other nerve pains that didn't start in the fingers or toes, this is probably not chemotherapy-induced peripheral neuropathy, but it can be. So we'll talk about what to do if that's the case as well. But in general, peripheral neuropathies start in the fingertips with some numbness and in the toes with numbness, including on the soles of the feet. And then they tend to go upwards. So they start in the toes and move up the feet, or they start in the fingertips and move up the hands. Why am I making such a big deal about this? I'm making a big deal because the people giving you chemotherapy need to know that you're having this side effect. And we will generally hold your chemotherapy till the side effect is better, or if we have to, reduce the doses. And one reason you might think about not telling your doctor is you don't want your doses reduced. Of course, we don't want to have to do that. But if you're having this side effect, it's important to know that we will just make it worse if we keep going with chemotherapy without any break at all. Delaying your chemotherapy while your nerves feel better, and delaying your chemotherapy, reducing the dose so that you don't get worse, is really important. Our hope is that you're cured and you live a long time after breast cancer, and you don't want to not be able to feel your fingers, and certainly pain long-term will really affect your quality of life. Now, as I mentioned, this usually gets better. The drugs we use in the treatment of chemotherapy don't have what's called a coasting phenomenon. If you've had other types of chemotherapy, in particular cisplatin, not carboplatin, but cisplatin, this can cause a coasting phenomenon. What I mean by that is you stop the chemotherapy and the neuropathy gets worse. It kind of coasts along. So we don't tend to see that in breast cancer, but I've had a few patients who've had that problem. And that's when the neuropathy is present and gets worse after you stop. It's after your last chemotherapy, basically. Many patients need to stop chemo early when they're on paclitaxel in particular, or docetaxel, so that the neuropathy doesn't get worse and it does not look like there's a decrement in the benefit. It doesn't take away the benefit of chemotherapy. If you want to learn about whether these drugs might be used as part of your treatment plan, go to Yerbba.com to learn more. If they're not part of your treatment plan, neuropathy is unlikely to occur. How do we treat peripheral neuropathy? Well, as I've mentioned, this can be just numbness, in which case, after we stop the chemotherapy, you will generally regain sensation in the feet and toes. But if you are living with long-term peripheral neuropathy, it will be graded. How severe is it? Is it mild, moderate, or severe? If it's moderate and associated mostly with numbness, we try not to give you more medications. If it's associated with pain and it's moderate, it's worthwhile talking to your oncologist, or sometimes even a specialist like a cancer rehabilitation doctor or a palliative care doctor. They can help manage medically the pain. If it's severe, I would say please get help, because living with a severe long-term side effect, even one that seems to be getting a little bit better, will decrease your quality of life. All this, and of course, when we start medicines to help the side effects of another medicine, they have side effects as well. So there are a lot of medications that can be used to treat peripheral neuropathy. We could actually post on our blog about this, because a lot of them have long names. Drugs like gabapentin and venlafaxine. These are long names, and so we'll write a blog post about what can be used to treat peripheral neuropathy. But you need to be on these medications for a while before you can get through the initial side effects of these medicines to treat peripheral neuropathy and to see if they work. In other words, don't stop them if they're not working after 2 days. And if you get side effects the first few days to a couple weeks, just stick with it, because if those side effects, those acute side effects, go away and it helps your neuropathy, they will be worth it. But there are a lot of drugs to try, so if the first one doesn't work, don't give up hope. You can try another one. Other things that seem to work are limiting the amount of time that you're using your hands or your feet. This is really hard to hear if this is associated with your job. So if your job requires a lot of walking or a lot of fine motor activity, you're a pianist, you're a violinist, or if this is one of your hobbies, that can be really hard to hear. So you are the best expert in your own body. I've covered a lot today. I've covered why we get peripheral neuropathy, what it is, what drugs are most likely to cause it, what kinds of symptoms you have, and how we treat it. If you want to learn more about your possible treatment plan, visit Yerbba.com to learn more. And if you like this video, click subscribe and like it, and drop us some comments, and that will help other people find this video, other people going through something just like you or something similar to you.